Good afternoon, everyone. The topic for today's class is Social Sciences and Health. The contents are introduction, definition, components of social sciences, theories of behavior change, risk behavior, conclusion, and references. Coming to the introduction, behavior is an action or observable practice in an individual, family, and community. And health behavior is a broad concept implying actions undertaken by people which have positive or negative consequences to health. The components of social sciences include sociology, cultural anthropology, social psychology, economics, and political science. Sociology is the science concerned with organization or structure of social groups. It is the science of behavior of man in a society or the group of human beings. So the structural aspects of the society includes the social institutions, community, and associations. The functional aspects of society include the social norms, which are the rules of conduct to be followed by the members of society. It includes folkways, mores, and taboos. Customs, it is a broad term involving the folkways or mores, which has been repeated by the generations. Habit is any acquired tendency to respond in an identical way in a situation, which is a purely personal affair. Etiquettes and conventions. Etiquettes are concerned with choice of proper form of doing something in relation to the other. And convention is agreed upon a procedure. Social values, which refer to the standards of judgment by which things and actions are evaluated as good or bad. They are the directive principles of human action and serve as criteria of selection. Coming to the theories of behavior change. So first is the health belief model. So this model is based on the five components, that is perceived susceptibility, perceived severity, health motivation, perceived benefits, and perceived barrier on which the actions depend. The second is the stage of change model, which is based on five stages. That first is the pre-contemplation stage, then is the contemplation, then we have the preparation stage, then action, and then maintenance is being done. The barriers to achieving the behavior change include lack of opportunity, lack of resources, lack of support, conflicting motives, long-term nature of benefit, conflicting motives, long-term nature of benefits, and belief that cannot change, it cannot be possible. Next is the health locus of control. The concept was developed from social learning theory and measures the extent to which the individuals believe that their health is influenced either by their own behavior or by external causes. It is not a measure of actual control of behavior rather than the perceived control over outcomes. So these are the different types of the locuses of control, internal and external. Social sciences and dental public health and the social stratification. So for this, we'll study about the different types of the social relationship, which are the different groups. Like they can be primary groups, like the families or the peer groups, etc. They can be secondary groups, like the professional groups. So these are the two main types of the groups, primary and secondary. So there is a doctor-patient relationship. It is a primary social relationship because the quantitative ingredients required for the primary social relationship. The number of individuals involved is small and in close proximity. So this is a very important thing. There are different models of doctor-patient relationship. So different models are paternalistic model and informative model. Interpretative model and deliberative model. So now this is the chart which is showing the comparison of all the four different types of the models, which is based upon the patient's value, physician's obligation, conception of patient's autonomy, and conception of physician's role. Coming to socioeconomic status, it is defined as the position that an individual or family occupies with reference to the prevailing average standards of income, education, and occupation. It is the way of segmenting consumers based on their purchasing power. It is often measured as combination of education, income, and occupation. So communities-based studies focus on the socioeconomic status because it is a key factor. So there is various scales for the measurement. Some of them are Radukar scale, Uday Parekh scale, Jalota scale, Kulshetra scale, Kuppuswamy scale, Srivastava and Bharadwaj scale. So all these scales is very important. So this is the first is the Kuppuswamy scale for the urban area given in 1976. It is based on three components: education, occupation and income. So this is the table showing how the Kuppuswamy scale, the rules and norms are there for the scale. So this is the revised scale given in the year 2020, which has classified into five categories: upper class, upper middle, upper lower, and the lower class. The lower class and the dental attitude as a group, they are the ones which reveal the more consistent neglect of the teeth because of the cultural differences, and they have less knowledge. So they have poor oral health. So we can see the attitude of the underprivileged people. There were various factors which show that there is the attitude have leading to the poor oral health condition. So we'll study about the attitude of these people. First is the castration complex. There is reluctant to be at the complete mercy of the health practitioners, marked by reluctance to have general anesthetic or sedation for the dental procedure. So it is offset by the desire of the parent to spare their children pain because they cannot explain to them. So this is the first model. Then contradiction to the common sense. Some dental medical procedures, such as continuation of the drug after acute symptom has subsided, seems to contradict the common sense. Coming in crowd, the disadvantaged people do not like to be outnumbered by the people providing treatment. For this, they come in crowds with families to private dental offices, etc. The last ditch effort, the disadvantaged often turn to medical or dental treatment by health professionals as last resort. So they are in sense challenging the health professionals for some hopeless situations. If it hurts, you are a quack. This group has a general feeling that medical treatment should be painless, and if it hurts, the practitioner is not doing well. So this is another very important problem. So unclean or dirty feeling, the aseptic cleanliness is another important, that there is not clean. The clinic was built there, not here. So since many facilities like hospitals, they're located in inconvenient places. So many of them to think that you do not care, you have to build the hospital over here. Cold professional attitude, the disadvantage complain about the cold objective attitude and conduct of the health professionals. Differences in pain threshold, the pain threshold for those in the poorest can be low. Then complications of the unknown, so they are unaware of the certain complications. The pills don't work. There's a tendency to expect that immediate results from the drugs. Appointments not important. They don't give any importance to the appointments. The teeth loss anyhow, they have a feeling that in spite of the care, there will be loss of the teeth. Then there are certain traditions that let the people not take the care of the teeth. Next, we'll talk about the risk behavior. So risk behavior is the special form of the behavior which are proven to be associated with increased susceptibility to the specific disease or the ill health. And risk factor is the social, economic or biological status, behavior or environment which is associated with the increased susceptibility to specific disease, ill health or injury. So harmful dental health behaviors include smoking, alcohol use, drug misuse and nutrition. Coming to the utilization of dental services, it is the actual attendance by the members of the public health to receive the care. Need, there are different types of the need for the people, which can be normative need, determined by the expert, felt need, that is felt by the patient, and express need related to the public measures. Factors which affect the utilization: age, gender, education, socioeconomic status, occupation, residence, sociocultural factors, organizational factors, and the cost of the health services. So these are the factors which determine the health of the people. Coming to the conclusion, social sciences play a major role in understanding the individual, his community, and his environment. The environment is unique to man and includes the cultural values, customs, habits, attitudes, morals, religion, education, income, occupation, standard of living, community life, social and political organization. So social science is very important and it plays a major role in promoting the oral health of the people. So these are the references in the textbook which can be referred for further reading. Thank you.